a bulge in the lower abdomen, also called the groin or the scrotum. Before birth, a male baby's testicles grow inside his abdomen and then travel to the scrotum. To get to the scrotum, the testicles must pass through two openings, called the internal and external inguinal rings, and a passage between them called the inguinal canal, formed by abdominal wall muscles. As the testicles enter the scrotum, tissue lining the abdominal wall comes with them, forming a sac. Normally, the opening of the sac into the inguinal canal closes within 6 months after birth. Sometimes, for unknown reasons, the opening of the sac does not close. As a result, the open tissue sac may fill with fluid that normally stays inside the abdomen. The fluid-filled sac surrounding the testicle is called a hydrocele. A small piece of the baby's intestine or some fatty tissue from the abdomen may also slide into the sac, resulting in an inguinal hernia. Usually, a doctor will be able to gently reduce or push the intestine back into the abdomen. However, the intestine may become trapped or incarcerated inside the tissue sac. This will appear as a hard and tender bulge and is an emergency. After about 6 hours, the intestine inside an incarcerated hernia may lose its blood supply and die. This is called a strangulated hernia and is an emergency that requires immediate medical attention and surgery to repair it. Hydroceles and inguinal hernias require an operation to tie off and remove the tissue sac to prevent future herniation and possible injury to the small intestine.